Hi everyone, Richard Nijelski here for FitLink. In this video, we'll demonstrate the correct procedure for performing and teaching the One Arm Dumbell Row exercise. The One Arm Dumbell Row exercise is primarily a two-joint motion exercise that targets the latissimus dorsi muscles, lower and mid trapezius, rhomboids, the biceps and the rear deltoids. For this exercise, a flat bench will be needed. However, there are other versions that can be done. When picking up a weight from the floor or off a rack, always engage the lower abdominals to support your lower back. Placing one hand and the same side knee on the bench so the torso is horizontal and the pelvis is in a neutral position, take hold of the dumbbell and allow the arm to hang down with the knuckles facing outwards. Engage the lower abdominals to support the spine and draw the shoulder blade down and back to stabilize the shoulder joint. With the elbow pointing backwards, raise the dumbbell vertically in a smooth motion until the dumbbell reaches the ribs or the upper arm is just beyond parallel. The elbow should pass the ribs and the shoulder should not shrug. Hold the top position for a moment and with control, return the dumbbell to the start position, extending the arm and the shoulder. As a personal trainer, just as important as being able to do the exercise is teaching a client how to do the exercise correctly. This will require the use of good communication skills and understanding your client's learning style. Let's now have a look at an example of demonstrating this exercise to a client.
Right, Kestra, today we're going to do the One Arm Dumbell Row. This is a one arm exercise obviously. It works the muscles of your latissimus dorsi, your middle and lower trapezius and a little bit of your bicep as well. Alright, so what I'm going to need you to do is I'm going to need you to use a flat bench. We've got the one dumbbell here as well. We're going to put one hand on the bench, one knee on the bench. You're going to have your abs nice and engaged, nice flat back. And what you're going to do is you're going to start with your arm at extension. You're going to pull it back, elbow next to your body, bring your shoulder blade back and down. That'll be the finished position of the move, and then I want you to lower back to the starting position. Make sense?
Sure does.
Cool. I'll go through a couple now, and then I'll get you to do it as well. Cool. So like I said, one knee on the bench. We're going to have one hand on the bench as well. I want your abs nice and engaged. Back straight as it can be, natural spine. Then you're going to pick up your dumbbell, starting position. You're going to draw your elbow back, bring your shoulder up. Make sure not to rotate your shoulders. Back to the starting position. Right, so we're going to come up, bring your shoulder backwards. Remember to retract your scapula at the top. And down. Does that make sense? Cool. I'll now get you to give it a go. So knee down, hand on the pad. Keep your core engaged, back nice and straight. Let's get the shoulder blade back. Good, 1. Elbow next to the body, that's good. Remember, bring that shoulder back, not twisting though. Good, core always engaged, back straight. Let's go 3 more. 1 more, good. And put that weight down nice and gently. And that's the One Arm Dumbell Row.
So that was an example of how to demonstrate and instruct this exercise. The principles of demonstrating and teaching this exercise can be applied to all similar exercises and movements. For some clients, there are some precautions which should be considered. For a client with little or no experience, start with a low weight and gradually increase the weight as they become more accustomed to the exercise. If the client is experiencing any pain, stop the exercise immediately and investigate. Clients with any shoulder instability, elbow and wrist conditions, and those with excessive lumbar lordosis should be cautious when performing this exercise. Modifications and alternatives may need to be considered for those with any contraindications.